And for further examination on the rise of medical tourism, we're joined by Joseph Woodman, the CEO of Patients Beyond Borders. Joseph, thanks for joining us this evening.
No, thanks for having me.
So is medical tourism mostly for elective or cosmetic procedures which aren't covered by health insurance with the aim of getting a better deal? Or is it for patients looking for superior medical treatment that may not be available in their home locations?
Well, that's a good question, and the answer is yes to both of them. It depends on where you live. If you're in the United States, where we've priced ourselves pretty much out of so many people have been priced out of the healthcare market, especially if you're uninsured or underinsured, you're going to be seeking value in other countries, which offer American accredited care for 40 to 60 and sometimes even 70 and 90% discounts off of what they would receive in the United States. If you're from a country that has very little care, whether it be Russia or Angola or even China in some cases, you're going to be traveling to get access to quality care that isn't available in your own country, diagnostics and treatment.
So what are the top destinations for medical tourism, and what procedures do those areas specialize in?
Well, it depends on your condition, on your as a patient, on your travel ability, on your appetite, on your budget. But as far as the American patient goes, Mexico has now recently become JCI accredited in 7 or 8 hospitals. So that's a great option not only for cosmetic surgery and dentistry, but for orthopedics and heart surgery. Some of the top hospitals in Mexico offer a broader range of treatments, 60–70% savings. India, for the value traveler, is well known, and they've established a lot of great hospitals. Malaysia is a real gem, fully English speaking. For the Chinese American heading across borders, Taiwan offers over 100 hospitals catering to the international patient.
Now, but what are some of the risks associated with traveling to get your treatment, be it elective or essential?
Well, every patient that travels for care needs to be informed. And there's a broad, just like in the United States, but even more so in developing countries, there's a broad range of hospitals. And there are some clinics in some countries where you have to bring your own bandages to get care. So there's a very select few hospitals, and that's what we've done with Patients Beyond Borders, is vetted those hospitals and supplied them information about them in terms of doctor's accreditation, doctor certification, facility accreditation. There's an organization, the Joint Commission International, the largest certification accreditation organization in the world, that has accredited now over 500 hospitals internationally, where just 10 years ago only a handful, 25, existed. So there's a lot of choice out there.
Now, speaking of choice, some countries actually literally combine the tourism and the surgery. Like in South Africa, you have surgery safaris where you get your treatment combined with a safari. It's a package deal. How prevalent is this very quickly in other destinations?
I think it's prevalent mostly in the media. Most people, we don't encourage medical tourism in that sense. We feel that a medical trip is more like a business trip, where you're there for a purpose. Most people, there's a lot, especially in South Africa, where you've got a lot of wound management. The first thing a cosmetic surgeon will tell you is you're not supposed to get out into the sun, and it takes 10 days to recover from any significant cosmetic surgery. So the answer is we like to see patients head to their destination, take care of their surgery, take care of themselves, pocket the savings, come home and recover, check out the 400 emails in their inbox, and then at some point take a family vacation after they're fully recovered.
Okay, get healthy first and vacation later. We're going to have to leave it there. Thank you so much, Joseph Woodman, CEO of Doctors Without Borders.